Hi everyone, Caitlin from Unified's Tobacco Treatment Program here with another video in our tobacco reduction series. And today in our video, we're going to be going over some frequently asked questions that we've heard in regards to NRT. So, what is NRT? NRT is nicotine replacement therapy. It is a type of pharmacotherapy used in commercial tobacco use reduction and cessation to help individuals quit or reduce their use. What types of NRT are there? The most commonly known and probably most commonly used would be the NRT patch and the nicotine gum or lozenge. But there are other methods as well, such as the nasal spray and the NRT inhaler. How does NRT work? NRT works to replace the need for cigarettes or other forms of commercial tobacco by providing your body with a small dose of nicotine. This can help you cope with cravings or during symptoms of nicotine withdrawal. How do I get NRT and do I need a prescription? For most NRT, you can actually purchase it directly over the counter, pretty much at any store in your area or any pharmacy. But you can also still talk to your doctor about a prescription if your insurance might cover the cost, which for most insurances, that's a good chance. So for options specifically like the inhaler or the nasal spray, if that's what you're interested in though, you do have to have a prescription from a doctor to obtain that form. What is the difference between the patch and the gum? So the patch is what we would consider a long-acting method of NRT, whereas the gum would be considered a short-acting. And what this means is that when we look at long-acting methods like the NRT patch, those are working to deliver a consistent amount of nicotine throughout the day, whereas a short-acting method like the gum will give you a smaller dose or a spike specifically for difficult or challenging moments when you may be experiencing cravings or other urges to smoke. What side effects might I experience with NRT? So there are a couple different kinds, and it can kind of vary depending on the type of NRT that you're using. But for the patch, you might face things like skin irritation, which can usually be solved by just moving the location of your patch, dizziness, racing heartbeat, sleep problems, or unusual dreams, specifically when you're wearing the patch overnight, headache, nausea, muscle aches, and stiffness. And for the gum or the lozenge, you might experience a bad taste, throat irritation, hiccups, nausea, jaw discomfort, or racing heartbeat. Now, some of these side effects might just be because the nicotine dosage is too high, which means that you might need to adjust the dosage of your NRT method, and that can be done by discussing it with your doctor and kind of discussing some of the side effects that you've been experiencing. So how much nicotine is in NRT? So it depends on the type of NRT you're using, and then of course there are various dosages within those types. For the patch, we most commonly see the 21, the 14, and the 7 milligram patch. And for the gum or the lozenge, you'll usually see about 2 or 4 milligrams. Should I talk to my doctor about using NRT? Yes. I think it's always a good idea to review any medications with your doctor before taking them for the first time, just to make sure there are no issues with any other medications or health conditions that you're currently living with. Plus, it kind of goes back into that, if your insurance does cover part of this medication, it's always better to have insurance pay for it when it's able to. Do you have any more questions about NRT or even just tobacco cessation in general? You can reach out to our team using the information on your screen, and you can also find more content like this here on our social media channels. Unified's Tobacco team is wishing you all a safe and happy holiday season, and we'll see you next time.